Before there was a pill you could take at the pharmacy, there was an abandoned hospital pantry. And in that forgotten pantry, the experimental guinea pig started mysteriously dying overnight. The ancient Greeks called it mania. For centuries, physicians could only helplessly watch, physically restrain patients, and pray earnestly for the mysterious madness to eventually pass. By the 19th century, the medicine cabinet held dangerous substances like belladonna, mandrake, and henbane, potent poisons that were mistakenly believed to serve as legitimate psychiatric cures. In the 1920s, Swiss psychiatrist Jakob Claessy administered week-long drug-induced comas to manic patients as an experimental treatment. Tragically, some patients never regained consciousness from these induced comas. Believe it or not, the original 7-Up formula actually contained lithium as an ingredient. Cardiac patients who regularly drank it began experiencing serious health complications and deaths from the excessive salt content. In 1948, Dr. John Cade arrived at Bandura Mental Hospital, a war survivor with no funding, no laboratory, and merely a scientific hunch about treating mental illness. He converted an abandoned hospital pantry into his makeshift laboratory, equipped with only a single bare bulb overhead and a dusty wooden table. He had absolutely no budget whatsoever. Cade collected urine samples from manic patients and injected the concentrated lithium-rich extract into guinea pigs to systematically observe behavioral and physiological changes in the animals. The guinea pigs convulsed violently and died within minutes of exposure to the substance. Cade believed he had discovered a potent poison present in the urine of individuals afflicted with mental illness or madness. But he carefully added lithium to the extract, a simple salt that conventional medicine hardly considered therapeutic. He suspected it might help stabilize the unpredictable chemical reaction occurring within the solution. The guinea pigs survived the unexpected ordeal remarkably well. They sat calmly in their secure cages, remaining wide awake and alert throughout. An accidental discovery of a genuine miracle had unfolded before everyone's eyes. Cade had survived 3 grueling years imprisoned in the harsh conditions of Changi prison camp. He understood intimately what it meant to risk absolutely everything for even the smallest chance at freedom, survival, and redemption. So before he gave it to any patient, he swallowed the lithium himself to test its safety. Then he sat back and waited patiently to observe any effects or reactions on his own body. Mr. W.B., 54 years old, had been manic for 5 consecutive years. He was prescribed lithium, and the medical staff carefully monitored his progress and response to treatment. In days, the acute mania lifted entirely. Mr. W.B. walked out of the hospital, seemingly restored to himself. It should have changed everything about his future and his life. But in 1960, a textbook declared that lithium has no therapeutic applications whatsoever. This groundbreaking discovery was consequently buried alive and forgotten. The pantry was locked and secured. The laboratory lay forgotten in disrepair. Lithium, a natural mineral extracted from Earth, could not be legally patented. No one wanted it then. Enter Mogens Schou, a pioneering Danish psychiatrist who personally witnessed manic depression devastate multiple members of his own family, profoundly shaping his lifelong medical career. 21 years later, in 1970, the FDA finally approved lithium for medical use. One prominent professor then raised a thoughtful question about whether doctors held a moral obligation to practice civil disobedience. Today, lithium sits prominently on the WHO list of essential medicines, serving as a critical psychiatric treatment. It saves millions of lives every single year worldwide. But here is the haunting truth. After 80 years of continuous scientific use and study, we still do not fully understand exactly how lithium works at the molecular and cellular level. Cade's original notes remain carefully preserved within a Melbourne archive. The answer to this enduring mystery may still be sitting there, patiently waiting to be discovered by dedicated researchers.